Hi, today I'm going to talk about the difference between nociceptive pain and neuropathic pain. The nociceptive pain is the pain which is originating from the nociceptors that are located in the periphery. For example, the nociceptors located in the ligament, the nociceptor located in the muscle, the nociceptor located in the tendon or even the joints. When there is a tissue trauma happens, like tendinitis or muscle tear or the ligament injury, these nociceptors will get stimulated and then they conduct the impulses via these nerves. Thereby the brain can appreciate that yes, such and such tissue is damaged. So the pain coming from the nociceptors of the structures which are there in the periphery is called as nociceptive pain, which indicates a true tissue pathology. Okay. Now there is one more type of pain which is called as neuropathic pain. This neuropathic pain is the pain which is originating from the nerve itself. These nerves can get injured in the form of infection or in the form of inflammation, or it can be injured in the form of tumor in the nerve, or it can be a mechanical compression like in the disc bulges. In such cases, the nerve will get damaged in the pathway. It can be in the anterior root level, or it can be in the spinal nerve level, or it can be in the peripheral nerve level. This nerve can get damaged. Once the nerve can get mechanically or even chemically damaged, the ectopic impulses will generate from the damaged part itself. Instead of the impulse generating from the periphery to the nerve, the impulse will automatically generate at the injured level. So normally the impulse should not get generated here. If it is generated due to that nerve trauma here, then we call that as an ectopic impulse or ectopic nerve conduction. So this ectopic nerve impulse will again go to the brain, but the brain will not know that the damage is happening in the nerve level. The brain knows that this nerve is representing this muscle. So for example, if this happens to be a C5 or C4 nerve, C5 and C4 nerve governs the area of the trapezius and the shoulder. So the brain doesn't know that the nerve at its pathway is damaged. The brain will only know that the area of the shoulder is painful. It does not know the difference between the C5 nerve problem versus the true shoulder muscle problem. Most of the therapists will think that since the patient is complaining the pain is in the shoulder level, they think it's a true shoulder problem, wherein the pain can come from the nerve. The brain does not have the capacity to appreciate and acknowledge the pathway problem, because every pathway is corresponded to some structured periphery. Any problem in the pathway, the brain will only think that the periphery which is corresponding to this particular nerve is affected. That's the reason why in sciatica the patients will feel the pain in the hamstrings and the calf, wherein the problem is in the pathway. Similarly, in C5 radicular pain, the pain will be more in the shoulder level, whereas the problem is in the pathway. So when the pain is originating from the nerve, we call it as a neuropathic pain. But unfortunately, the patient, even the doctor sometimes will get deceived by the locality of the pain, and then they think that the problem is in the periphery, and then they end up giving massage and then acupuncture or stretching or strengthening without even knowing that whether the pain is a neuropathic pain or not. If the pain is neuropathic in nature, and if the patient feels the pain is in the periphery, this pain is more or less like a phantom pain. What is phantom pain? There is no real tissue trauma, but the brain strongly feels that there is a pain there. Okay, so sciatica is also a type of phantom pain. The radicular pain is also a type of phantom pain because there is no real tissue problem, wherein the patient will strongly believe that there's a tissue problem. Amongst all the reasons for the neuropathic pain, the cervical and lumbar disc bulges are the most commonest reason for the neuropathic pain. Apart from that, it could be because of spinal canal stenosis or ligamentum flavum hypertrophy. Sometimes it could be due to the spondylolisthesis or even fractures, but those are all very uncommon. Even your nerve infection and the neuromas, they also can cause neuropathic pain, but they are not so common like the cervical or the lumbar disc bulges or disc herniations. So physios who are dealing with pain, you have to know the fundamental difference between the nociceptive pain and neuropathic pain, so that you give a right treatment based on the nature of the pain. If the pain is neuropathic and then if you think it's nociceptive, you are going to lose the game. If the pain is nociceptive and if you're going to think neuropathic, again it's a problem. Understand the pain better so that you can treat the patients better. So did you learn something new today? Thank you.